Welcome back to Insight. We're at Indiana Physical Therapy with Brian, who's going to try to make my elbow feel better. And what technique are we using today?
It's called SASTM, which is basically sound-assisted soft tissue mobilization. This is the third generation of the tools. Some form of generation of the tool has been around since the late 80s.
It's scraping, right?
Yeah.
Yeah.
It's the generic term is scraping.
Yeah.
And the benefits are that we can dislodge or break up some of the fascial restrictions, which then promotes motion as well as reduces pain. I mean, this technique is used commonly and very effective in treating like Achilles tendonitis, plantar fasciitis, medial and lateral epicondylitis, rotator cuff, myofascial pain, and even post-surgical or traumatic scars.
Wow.
I mean, it's beneficial with all those.
So it kind of breaks up that scar tissue essentially and promotes healing?
Yeah. And you mentioned you had a...
Yeah, I got an elbow that...
elbow needs a little bit of
it's probably
care.
Golf or lifting weights, very light weights.
I brought a few of these tools along with us today, and the SASTM tools all have a flat edge, a blunt edge. So what we've already done an evaluation on you, and then we've identified with our hands some of the sore spots or some dysfunction that might be occurring. What this does then is it magnifies, since it's such a dense material, it magnifies the sound waves and then let's get going.
Okay. So this does what? That's
just a moisturizer.
Okay.
Which then prevents some friction burn as well as
all right.
As allows
yeah, it smells good.
some cocoa butter. So we get that up. In the first tool, the first stroke, is called a scanning stroke. It's usually done at a 45-degree angle from the skin. A 45-degree angle from the skin. It's done a little bit more rapidly and in long strokes.
Okay.
So you just kind of, until we locate exactly that area of dysfunction. What I'm trying to feel is a little bit of grit, like right about there, a little bit of soft tissue restriction right there. This tool allows us to scan a larger body area fairly quickly, and you've got to match the tool with the appropriate body size.
That didn't hurt. It didn't feel like anything.
No.
But
you can see where we've already started seeing some reddened area.
Right.
So that's where a lot of the area of restrictions are.
Okay.
And then you can get, a little bit.
Now,
so
how soon till I feel better? How soon will I notice the difference? Immediately.
Yeah,
Awesome.
you'll feel pretty soon, and you'll start seeing. So we're still in the scanning and type of stroke. So once we go to the bigger area, we're using a bigger tool.
All right. Well, again, if people want to find out more about this whole procedure, because this is great, actually.
Yeah.
And if I'm going to feel better right away, Indiana Physical Therapy, dozens of locations around Fort Wayne. Go to their website to learn more. We'll be right back on Insight.